So.
All right, Gibby, right?
That's right.
All right, so I want to show you a couple of things. So you've had this, when did this first pop up?
I'd say about 4 days ago.
All right, and it's been draining a little bit?
Right, I've been keeping an eye on it, cleaning it and stuff like that as much as I can.
How about warm compresses? You've been putting warm compresses?
I've done that a couple times.
Okay. And how much has come out of it or drained?
It's on and off. Sometimes it seals up.
Yeah.
Sometimes when it does, like say I bump it into something or something, it'll decide to come out.
Okay. Have you had any fevers, chills, nausea, vomiting, anything like that?
None of that.
Good for you.
Thank
All
you.
right, so you see this red mark all around here?
I do.
Okay, so that's the area inside is a cellulitis infection. All right, so that means that the staph infection, and this is presumptive staph.
Okay.
The staph infection is actually traveling under the skin, and that's why this is turned red. One of the things that we like to do is take a marker, a pen, and we like to kind of just mark the edges of this.
Right.
There we go. And ask you to try not to wash that off, all right? Because that way we can track and make sure that this infection is actually receding, right?
Gotcha.
So it goes right, see how it goes there? Right there, you can kind of, when I put the outline on it, it makes it easier to see, but over here it's a little bit, let's see, can you twist your arm?
Yeah, of course.
I'm kidding with you. There we go, right there. So this is actually a fairly large cellulitis.
Okay.
And this is a furuncle. Actually, it might be a carbuncle. So you see that spot right there? So that's an opening that's drained, and you're draining over here. So that's actually a carbuncle. So furuncle means you have a single tract. Carbuncle means you have multiple tracts. And so you have a carbuncle. So here's what we're going to do with this. We're going to numb this up a little bit for you.
Okay.
Then we're going to
Give it a little slit.
open it up. That's right. Now, this is not a cyst like an epidermoid cyst or a pilar cyst.
Actually,
It's
I have
not
one on my wrist. So.
yeah, that's a ganglion cyst, right?
Right.
Yeah. All right, so this is actually just a plain old, now you thought maybe spider bite. Hey,
Right.
could
Thankfully
be.
it wasn't.
Could be. Who knows?
Oh, okay.
But we know right now that it's carbuncle and that staph is involved. So we're going to get a little culture. We're going to send that off, and we're going to see what grows, and we might adjust treatment based on that. So Jenny is going to stop here in a moment, and then we're going to get you set up. Okay?
Let's go.
Okay, we back.
Okay, she's got to make sure that Jenny likes to be on the video. We're back with Gibby. We have an infected right forearm here. Pretty sure he thinks it might have been a spider involved. I don't know. You know, it's hard to tell. I mean, and this showed up about a week ago, you said?
Yeah.
Yeah. And then when did it get real ugly like this?
I'd say fairly recent, like 2 days ago.
Okay.
It started swelling like that.
Okay. All right, what's in the syringe? Hang on. What's in the
Oh,
syringe?
lidocaine with epi.
All right, very good. All right, I'll get it. So we don't want to spray the cold spray directly into the wound, right? This is ethylene chloride. We can actually cause more tissue damage there. So this is actually a cold spray. It's going to help this not hurt quite as much, but this will hurt a little bit, okay? All right. You kind of expect if we put a needle in you, it would kind of hurt a little bit, right?
Right. I understand that.
There we go. Little stick. What's it going to feel?
A stick in a burn.
Right. Okay. Here goes the medicine. Well, that went right into the wound there. So we really want it just to go into the skin like that. See that?
Yes.
That way it stays and actually will begin to give you some local anesthesia. There we go, right here. So we're just going to kind of go around like this. No, you're fine. You're fine. A little more there. I like to actually show the, you know, the anesthesia because it's a big part of the procedure, right?
Yes.
Right.
And if we go all the way around like this, we've got a much better job of making this as painless a procedure for you as possible.
I appreciate that.
Absolutely.
I like it when you tell the audience, students, that when the medication goes in, the skin turns white like that.
It blanches, right?
Blanches.
Yeah, it blanches. Okay, so let's give that just a moment. Thank you very much. All right. And then what we're going to do is we're going to gently express this. After that, what we'll do is we'll get a culture. Let me give that to you. Could I get a couple more 4x4s, please, ma'am? Thank you. All right. Yeah, thanks. All right, great. All right. You feeling anything there?
I have no preparation at all. Tell us about Meta 7.
I started taking it about 6 months ago. It has totally changed my life. Lost 35 pounds. Was sitting on the couch all day long. Had no energy whatsoever. Now I can't sit down. So it's really working for me. I hope it works for everybody else.
You can sit down, you just don't want to.
I don't want to.
All right, man, and you're here for another bottle, right?
Yes, sir.
All right, fantastic. How's your clarity and focus?
As
Are
far
they
as as far as brain,
Yes,
oh yeah.
yeah.
Oh yeah, I can think
If
better.
I only had a brain, right?
I can think better, and all around it's helped me out.
Do you feel shaky, jittery, or anything like
No,
that?
not at all.
Fantastic. We're gonna hook you up, bud. Thanks a lot.
Thanks.
A big opening here.
Right.
Did you realize that was there?
I did not. I saw a little opening on it,
Yeah.
but I didn't know it goes.
Yeah.
something like that.
So we're going to go ahead, and this is where you want to get your culture from. You want to get in here, and is this a regular wound culture at?
Yes, sir.
So we get it right up in there. Does that hurt? Good for you. All right. Because, you know, we don't want you to feel pain, but
Right.
we needed to get in there.
It's necessary.
All right, so this is a more complex wound. The fact that this is not bleeding very much is actually not a really good thing. It tells me that there's been so much tissue damage that your body has already begun the process of walling off some of these vessels.
All right.
All right, so thank you. Could I have forceps? Do you have a toothed forceps? That is a hemostat. Do you have a forceps?
One with teeth.
Yes, I like the teeth on my forceps sometimes. This is one of those
Attraction.
ones. So we won't be able to put a stitch in this, okay?
Right.
We're going to need to leave this either open or we need to pack it, and we'll decide here in a few
Mm-hmm.
minutes which one. We'll probably be able to just leave it open and put a dry dressing over it.
Gotcha.
So what that means, over the next 24 hours, this is going to ooze, right? It's going to ooze, and you're going to have to replace the dressing a few times, but we'll give
Right.
you a wrap to kind of help.
Okay.
I'll
Only
leave you
question
some
is with it being like dead around the side, like you were saying. Like, I guess would that go away with time, or is that?
So your body's going to heal this, but it's going to take some time. That's
Right,
right.
right.
And you are going to have a scar when this is all said and done.
Beautiful.
All right, we have a little forceps here. So what I'm going to do in
That's
here now
character.
is some of this necrotic material, some of this tissue in there, I'm just basically going to pluck it out, okay? There we go. So for those of you that are in a primary care setting, you're in a urgent care setting, or you're in a family medicine clinic in a rural area, that kind of thing, this is not something that you have to send to a surgeon. They don't have to go to the emergency department. You can treat these, okay? And you treat it by making sure that you perform circumferential anesthesia all the way around, right? It's very important, because if you miss a spot, it's going to hurt. And then gently remove the grayish colored, what appears to be necrotic or dead, right, tissue, and then use antibiotics. What's important here, though, don't get any kind of ointment in here, right? I'll give you, that's for you too, right? So we don't want to put any ointment in here, because if we do, we'll plug areas off that then could cause an abscess to form. We don't want that, right? No abscess. This is bad enough already, right? You might feel a little of this at the bottom. I hope not, but that's actually pretty good. Could I get a cotton-tipped applicator, please? Thank you. We're just about done, my friend.
Yeah.
Just looks like your body had done most of the work for us. We didn't need to make an actual incision, right? We didn't need to,
That's awesome.
because we just,
Due to all the necrotic
yeah,
tissue.
we just gave it just a gentle, squeeze, and there we go. Could I also get a little bit of dilute hydrogen peroxide? So I just want to make sure we don't have any areas that are loculated, and I think if we had an abscessed or a loculated area here, we'd feel it. We don't. You don't.
What
We're
is it,
okay.
Inoculated or something?
Loculated.
Loculated, sorry.
I mean, would mean like an area where fluid is walled off.
Oh, I
right?
see.
There we go. There we are. Thank you. Perfect. And just a little of the bubbly in here. Isn't that fun, huh?
So I type.
No, that's going to be good. All right. So I sent in, I've already taken care of the antibiotic for you. So you're going to take trimethoprim. We have really great staph sensitivity in our area for trimethoprim sulfamethoxazole. You're going to take one of those pills twice a day.
Okay.
And when you get over to the pharmacy here, I realize it's mid-afternoon. You can take one right away in the pharmacy. You'll take the second one tonight before you go to bed. Then it's going to be twice a day, all right? We want to see you tomorrow. We want to re-examine this, make sure this looks like it's getting better tomorrow.
Gotcha.
All right, so let's get you on the schedule to come in tomorrow afternoon. Tomorrow's Friday. We should be
sure.
fine there. And unfortunately, we're going to have to give you a little cephalosporin injection.
Unfortunately?
Unfortunately. Well, it might hurt a little bit.
It's like a thicker needle or something?
Longer.
Did this hurt much when we injected that?
I wouldn't say it was too bad.
Yeah, the shot will probably hurt a little bit more than that, I guess.
Okay, gotcha.
Any other questions? Can you take a shower? Yes, absolutely. Remove the dressings.
Yeah.
Take a hot shower. This can get all wet. That's fine. Okay. When you dry, just pat. You don't have to wipe or rub, okay?
Gotcha.
Any questions, Jenny?
Not
You're
that I can
Gibby.
think of.
She's Jenny.
Right. It's close. It's close enough.
No, Jenny didn't have any further comments. Yes.
So do not put any, just Band-Aid on?
We're going to put a dry dressing on this, and then we're going to wrap it for you. This will continue to ooze. Now, the medicine that we use for anesthesia, we had a bit of a medicine in there that kind of reduces the amount of bleeding.
Right? Interesting.
But that'll wear off, and this will bleed a little bit more. So just having a pressure on there should take care of it. But you may need to change it out a couple of times. Don't be surprised; it's going to bleed through or ooze. That's fine. That's all. Epinephrine is what we use, and it's a potent vasoconstrictor. And it kind of, once that wears off in a few hours, you will get a little bit more bleeding. Don't let that frighten you. Now, if bleeding soaks all the way through and squirting out or something crazy, well, yeah, call us. We have somebody on call after hours. No problem.